Hi, welcome back to the Becoming Equal project. We hope you enjoyed last season and are eager to jump back in and keep learning. This season, we will be learning about gender identity. So buckle up, grab a notebook, and let's get to it. This season, we'll be discussing gender identity, meaning how each person sees their own gender and believes their own gender to be. This may or may not be the same as the gender you were assigned with at birth, like we learned last season. Let's break down the terminology we will be using in this episode. Gender identity. One's own internal experience and perception of self. Gender. A set of cultural constructs describing characteristics that may be historically related to men or women, masculinity or femininity, non-binary people, or social norms. Cisgender. Someone who identifies with the gender that they were assigned with at birth. Transgender. Someone who doesn't identify with their gender they were assigned with at birth. Someone who identifies as cisgender will feel that the gender they were assigned with at birth, whether male or female, is the correct gender. This term is not an indicator of one's gender expression, attraction, hormonal makeup, or physical anatomy. On the other side of the spectrum, someone who identifies as transgender, this meaning that they don't identify with the sex they were assigned with at birth, and if they choose, will undergo various medical treatments to have themselves be more aligned with their gender identity. For example, someone who is trans male, born female, but identifies as male, can choose to undergo gender-affirming surgery, take hormones, or have top surgery, a bilateral mastectomy to remove their breast, to be more aligned with their gender. Whereas someone who is trans female, born male, but identifies as female, can also choose to undergo gender-affirming surgery, take hormones, or have top surgery, breast augmentation, to have their physical self be more aligned with their gender. Not all transgender patients will want to have surgery as a part of their transition, and for many, it is not possible due to insurance, financial barriers, or the lack of understanding or support in their country. There's a lot to consider when transitioning, such as the risk, the benefits, and the alternatives, which should all be discussed with each individual and their medical team, along with what their personal goals are for their transition to determine the right course of treatment. We hope this provided you with some insights on what gender identity is and the basics of identifying as cisgender or transgender. In our next episode, we will be discussing some of the other gender identities on the gender spectrum. We hope to see you there. Bye!